And if anyone's listening and wondering, well, how would I know if it's not any pain to it, any infection? I'll give a quick case because I've had Fraser on, Bailey, who was behind Root Cause, the documentary who was made over, who my father first identified. I remember years before he made that, first said, hey, you got a tooth problem, right? I'm seeing this now. And that's because he went everywhere and he had chronic fatigue. So that was his issue. Young guy, healthy guy, got punched, and had a root canal, and the whole story goes on from there. But it was chronic fatigue. It was just malaise. It was, not feeling himself, depression, these sort of things that come along. So no one was going to tell him it was due to his teeth, right? That was the last thing most doctors told him.
Right.
And it was only after, my father said, and a few other people said, hey, what about your teeth, right? And then he got cone beam imaging, found, the pocket there that was infected and causing all of this. Now, if anyone's listening and say, okay, I might have some of that, I have a root canal, or I've been thinking about something in my teeth may be the issue, would you say, go get a cone beam imaging done? Or is there a different starting point even?
Absolutely not. So part of my protocol is a cone beam. I have a saying, I said, if there's no cone beam, there's no diagnosis.
Right.
Yeah. Because you cannot see what you cannot see in two-dimensional.
Yes.
You have to have the third dimension, especially on multi-rooted teeth like upper molars. They have 3 roots. And the X-ray beams in two-dimensional are coming sideways. And it's too dense in between all these roots to see anything that's happening in between the roots. But now all of a sudden, when you can see in between these roots and you can see down inside, and that's why I said, when I pull multi-rooted teeth like that, I go into the bone in between the roots because I want to see that blood coming out of there. That oil slick that comes out of there, that's not healthy blood.
Yeah.
It doesn't take, anybody can look at that blood and say, there's an oil slick in that blood. That's not red blood. I've seen orange blood come out in between dead teeth. And, so back to the cone beam thing, not only that, and diagnosis is a really important thing. And we can certainly talk more about diagnosis on teeth that are vital as well. That's part of the biodentist way. But for your listeners today, absolutely get a cone beam and also go to a dentist that's going to interpret this in such a way that what they're looking for is not just less bone density around dead teeth, but also look at the cavitation sites, because most cone beams, if not all, have the ability to measure bone density in what's called Hounsfield units. We can cursor over the area in the bone marrow and we can see if it's positive or negative. And if it's negative, it's for sure you've got a lack of mineralization in the bone. And the question's always what's in there. And typically it's the hidden gangrene. There's a good book that's out that I want to mention here. It's Tom Levy's book called Hidden Epidemic. And that's our patient on the cover of that book. And we worked closely with Dr. Levy, and this patient, she showed up with at least a dozen root canals and had all kinds of health problems. And just, you feel like you're dying when you have that much death in your body. I can see why. And so we, over the course of time, went through the biodentist way. And, it took about 2 years to finish the case because it involved a lot of implants and bone grafts and things like that. But and that's kind of on the extreme. But there are some people that are in that condition where they just don't want to lose all their teeth. But my goodness, to have the tooth replacements are always compromises. Even zirconia implants, which I love. I have them in my own mouth. After having titanium, I took it all out and put zirconia in now, and what a difference it makes. Unbelievable. But not everybody can really wrap their head around that or has the financial resources to do something like that. But even replacing teeth with a well-fitting denture that has sharp teeth in it, I'm a lab technician. I make a lot of my own appliances, and you can't see them. You look in the mouth, you see nothing but sharp teeth and well-fitting appliances. And that's another option as well. Of course, you lose a fair amount of bone going that direction, but and that's the big advantage to implants is they're much more like real teeth. But to get your health back is the main thing. You got to start with really being thorough and having the right proper diagnosis. And cone beam is absolutely part of that. And so is heart rate variability.
Mm.
Yeah, we look at that as well. We feel like heart rate HRV is a real important piece to really just let us know, is the patient in sympathetic or parasympathetic lockdown, which really changes our approach to doing dentistry at that point. So
yeah, very cool. We use HRV as well. Which system are you using?
My wife is here; she can tell you.
It's the autonomic nervous system. It's a very high level autonomics testing from Dr. Rao.
Yeah.
No, okay. Yeah, we use here HeartQuest from Dr. Michael Kessler. That's similar to, I think, what Rao uses as well. But really looking at the ANS, or as far as balancing, right, and understanding, are you in that sympathetic state, overstressed? Then you have hormonal imbalance, everything else. So that's very cool that a dentist, could use that and is applying these things to really analyze and, like you said, truly diagnose.